Hi, this is Dr. Levi, the fitness doctor. Let's talk about carpal tunnel syndrome. As a hand surgeon and as an orthopedic surgeon, it's one of the most common injuries that I treat. Carpal tunnel is the #1 nerve impingement or nerve entrapment problem that people present with. Now, I want to go over the basics of carpal tunnel syndrome. The carpal tunnel, for example, is this area here on your hand. And the base of the carpal tunnel is formed by bones called the carpus. On top of that, there's a transverse carpal ligament. And this impingement from the bones and from the transverse carpal ligament can cause carpal tunnel. Well, what's inside the carpal tunnel? The median nerve, as well as multiple flexor tendons. And if there's thickened tenosynovium, which is a thick material that can happen over the tendons, and there's impingement from this, as well as swelling in the nerve, then you can present with carpal tunnel. What's the common presentation of carpal tunnel? Tingling and numbness in the hands, decreased grip strength, pain that awakens the person at night. The median nerve innervates your thumb, your index finger, your middle finger, and this half of your ring finger. Often people will present with numbness and tingling in their hands, as well as a feeling of weakness and loss of dexterity. Now, long-standing carpal tunnel syndrome, there'll actually be atrophy and wasting of these muscles, called the thenar muscles of the hand. Well, what are the risk factors for carpal tunnel? There are many. There's a hereditary component. Often people in the same family will all have this issue of carpal tunnel. Not all the time, but often. It can also be caused by repetitive motion. I see this often in the gamers that I take care of. I see this in people who have repetitive stress at work. For example, court reporters, racquetball playing injuries. Also, I've seen this in athletes that I take care of. Of all the high-powered athletes that I take care of, often those that have sports that require use of a racket or even handball, many of them, because of the repetitive motion, will present with carpal tunnel. Now, actually, you have to know this. You can have carpal tunnel and not have any of those risk factors at all. You just have it. Many times people have rheumatoid arthritis or diabetes, which are also risk factors for developing carpal tunnel. And pregnancy. I've seen many women who have hormonal changes can develop what's called gestational carpal tunnel. Many times it will go away after the birth of the child, and sometimes it doesn't, but usually it does. Let's talk about preventive issues with carpal tunnel. #1, it's important to take a break. If you're doing a lot of typing or keyboarding or gaming, at least 5 minutes every 60 minutes to rest your hands, to shake your hands out. And I'll show you later some gliding exercises that are very, very helpful when you have carpal tunnel. As an orthopedic surgeon, and more importantly, as a holistic integrative surgeon, I want you to know that there are many things that you can do to avoid and minimize the risk of carpal tunnel. If you do develop carpal tunnel, it's important to do gliding exercises. Consider wearing a brace at work. Make sure that your workspace is ergonomically balanced. #4, you can consider some physical therapy and even acupuncture. I use acupuncture for many of my patients in my office, and we have great benefits and great relief with that. Also, you can use ultrasound to help with this. So I want you to know, if you do develop carpal tunnel, surgery is not the first step. You want to try everything that is non-invasive first, and then if those modalities don't work, then your doctor may consider giving you an injection with a steroid. And if that doesn't work, the last thing at the top of this pyramid would be surgery. So let's review this again. Anti-inflammatory medication, bracing, physical therapy, ergonomic changes in your workspace, wearing a brace, taking frequent breaks at work from typing or keyboarding or from gaming, of course acupuncture, and then a steroid injection, and then the last thing to consider would be surgery, which is a very small procedure, but yet with anything, surgery always risks of bleeding, infection, pain, scar, a lot of things that you don't want can happen with that. Remember, surgery, like taking a medication, can only do one of 3 things: make you better, make you worse, or no change. Of course, the goal for your healthcare practitioner is to make you better. Well, I hope that's been instructional and informative for you. This is Dr. Levi, the fitness doctor.